we have seen a positive result turning negative from the 8th day to the 15th day, and negative result turning positive from the 8th day to 15th day. Getting a positive result is a very big nightmare, and sustaining that positive result is another nightmare, and always all these things happen by miracles and divine blessings. Now we are into the 25th part. What is in this 25th part is something very interesting and very happy news for everyone. That is how to confirm the pregnancy test, and what are all the additional things to be aware during a positive pregnancy or whether it is a negative pregnancy. So mostly after the embryo transfer, we need to check the beta HCG levels and the pregnancy card on the 15th day. So on the 15th day, generally if the pregnancy card becomes positive and the beta HCG is anywhere between 200 to 500 or 600, it's a very strong pregnancy. Sometimes it is exceeding 700, 1000 and 1500, it means there is a chance for a twin pregnancy. So based on the beta HCG, there may be a small judgmental assessment. It can be a positive pregnancy, singleton or twins. So this is one thing we are able to have a small judgmental. Secondly, we need to understand after the embryo transfer, sometimes even from 8th day onwards, the beta HCG will start rising up. So sometimes if you do beta HCG from the 8th day or a pregnancy card from the 8th day, in between the days of HCG, suppose if you are taking HCG injection on 5th day and the beta HCG has been planned, next HCG injection is 8th day or 10th day or 12th day, before the administrating of this HCG injection, you can do this testing out of inquisitiveness to check whether we are getting ahead a positive result. However, if the result is positive or negative, the best thing is to wait till 15th day, because we have seen a positive result turning negative from the 8th day to the 15th day, and negative result turning positive from the 8th day to 15th day. So these are all something we need to understand. So there are many doctors are having this because they are all equally happy and enjoying that moments with you. They are seeing something. It's not like purely medicine. We are transferring the embryos. It is a teamwork. The embryologists are loading the embryos inside, and they have to load in such a way. The clinician is having one methodology of pushing the embryos. She will use a particular pressure, and that particular pressure is known to that embryologist. So accordingly, they fill the fluid medium along with the embryos. If the fluid medium is slightly less or more, the embryos might hit and return, or may not go to the exact placement where they are expected. So many things are happening. So getting a positive result is a very big nightmare, and sustaining that positive result is another nightmare, and always all these things happen by miracles and divine blessings. It's not a clinician, especially a doctor who is practicing fertility, will have a lot of divine beliefs and divine followers, because beyond their controls, so many things are happening on a day-to-day life in this industry we have witnessed. So this is something we need to keep in our mind. Secondly, after getting this result, immediately within a week to 10 days, make sure your gestation is intrauterine or extrauterine. Sometimes if the implantation has taken place inside the uterus, there is no problem. If it is going to be a tubal pregnancy or anywhere other than outside the uterus, an ectopic pregnancy, we need to take immediate intervention to remove that embryo which has got implanted outside the uterus, because it will end up in miscarriage and sometimes unwanted complications. So this is one thing you should keep in your mind. So follow your clinicians, follow their advice, and for your understanding, for your awareness and knowledge sake, I'm telling, do 15th day beta HCG test, basis the value, confirm whether it is biochemical pregnancy or a singleton or a twin pregnancy, and subsequently monitor the scan to confirm whether it is intrauterine pregnancy or outside the uterus pregnancy. Accordingly, the treatment has to be planned. Okay, we'll meet in the next part.